Hello everyone, my name is Lisa Deal and I'm here today to discuss with you medication therapy management. This short presentation will contain information for patients to understand the WISEWOMAN Program for 2022. The WISEWOMAN Program is a program funded by the CDC and stands for the Well Integrated Screening and Evaluation for Women Across the Nation. In this presentation, we will review the WISEWOMAN program that's available here in Delaware. I will introduce medication therapy management from a pharmacist, and I will discuss some patient success stories with medication therapy management. WISEWOMAN Project enables qualifying women to receive free screenings and counseling about their risk for heart disease and stroke. Women are then supported as they participate in evidence-based lifestyle programs, individual coaching, or referred to other community resources. What I really enjoy about the WISEWOMAN program is it really gets our patients and community connected with resources that you may not have known were available. The WISEWOMAN program uses various strategies to improve the health of our patients in the community. We track and monitor the health of our participants using easy-to-obtain measurements like blood pressure and waist circumference. We encourage team-based care, meaning we want all of your care providers in your community to understand what the WISEWOMAN program can do for you and understand that this program can help to reduce the risks to prevent high blood pressure and heart disease. WISEWOMAN also wants you to utilize resources in your community that you might not have even known had existed. We have a lot of different resources that are available to help you during your health journey. The WISEWOMAN program has shown to have several benefits. First, it increases access to healthcare providers. It provides better blood pressure control for our patients, and we can diagnose and treat high blood pressure and heart disease much more quickly than if a patient was navigating the healthcare environment on their own. So within WISEWOMAN, we have a medication therapy management program. This medication therapy management program allows for a thorough review of a patient's medication by a pharmacist in order to provide the highest quality of care. So a pharmacist can review a medication list and they can confirm that there's appropriate medications for diseases. Sometimes patients can be on medications that should have been discontinued and that the patient doesn't need anymore. And sometimes because a patient goes to multiple doctors that sometimes don't speak to one another, they're on several of the same medication. So the pharmacist can review the medications and work with the providers to reduce the number of multiple medications. Pharmacists can also check for interactions between medications, monitor for any side effects that the patient may be experiencing, and they can adjust the medications. Maybe a dose is too low or too high, and maybe based on blood work and lab results, medications should be added or taken away. If you enroll in the WISEWOMAN program and schedule an MTM session, it would go something like this. First, the pharmacist would collect data, meaning they would get your medication list, they would look at lab values to see what your labs are, they would speak to a provider to understand your biggest concerns, and then they would take all that information and review it all together and develop a plan. During that session, we may want to take your blood pressure, your height, your weight, and your waist circumference. We would record and update the medication list. I try to provide all my patients with a brand new medication list that's printed out, that's professional, and has all the information you need. The medication, the dose, when you take the medication, when you started the medication, and in what year, and then what is the indication or why are you taking that medication. And then I, as a pharmacist, would write a progress note that I would give to all of your doctors to let them know what we discussed, what changes I think would be appropriate, and then we can open the lines of communication between the providers and yourself and make sure that you have the best possible medication list and decrease the amount of medications while improving your overall health. The MTM program has many benefits. One of the most important benefits is improved knowledge of medications. Not only are you going to understand what the medications are being used for, but also how do they work. The MTM program will provide the patient with a comprehensive medication review of not only your prescription medications, but also your non-prescription medications. There are so many drug interactions between prescription and non-prescription drugs, it's really important to get a comprehensive list. Then that comprehensive list can become your personalized medication record that you can keep on your person and you can give to all of your providers that ask for your medication list and feel confident in knowing that you have the most up-to-date list. The pharmacist will also develop a medication action plan. We will utilize goals that you want to achieve, like blood pressure, for example, and we'll set checkpoints to check in and see how your blood pressure is doing and look to see how the medications are helping. Most importantly, like previously stated, I'll be able to, as the pharmacist, enhance communication between you, the patient, and all of your doctors by sending them a progress note that has all of the discussion that was done regarding your medication action plan, the comprehensive medication review. We really can get all the providers on the same page on what you want done and what's important to you. I want to give an example of one of my patients that I had previously and how the MTM program helped her. This patient was an elderly patient who had uncontrollable high blood pressure, and she was already maxed out on several blood pressure medications. She was taking her medicine and she was limiting her salt and caffeine intake, and she still wasn't having any success in lowering her blood pressure. During the comprehensive medication review that I performed, the pharmacist discovered that the patient had been taking an anti-inflammatory medication called meloxicam, and she was taking it not as needed, but every single day. This medication is usually only given as needed, and the patient wasn't scheduled for it to be daily. Meloxicam is actually known to raise blood pressure and can also increase a person's risk for stomach ulcers and bleeding. The pharmacist coordinated a discussion between the provider and the patient, and she stopped the meloxicam. Her blood pressure returned to normal. She was even able to lower the doses of her blood pressure medications and discontinue one of them. So as you can see, the MTM program allows for pharmacists to be a part of the healthcare team and improve every step in the medication use process. Pharmacists have been shown to improve disease state management and pharmacotherapy. They can improve patient adherence to medication and overall quality of life. Believe it or not, compared to usual care, patients who take part of an MTM program show a greater reduction in hospital admissions and unexpected provider office visits. Close monitoring by a pharmacist can lead to improved adherence, meaning taking your medications, due to frequent check-ins and follow-up. Thank you so much for taking the time to listen about MTM programs today. We encourage you to get involved with the WISEWOMAN Program and Quality Insights and their MTM program.